Right, welcome once again. We do analysis of current occurrings, politics, and other matters affecting our lives as a people. I am welcoming you. I'm your host, James Kimathi, and I want to invite you today. We are having a discussion about an issue that has been in the news and all over trending. Ebola. Do we have Ebola in the country? Is there any trace of Ebola in Kenya? We hear, and there are reports that have been there in international media that the Americans are working with the Kenyan government to establish an Ebola quarantine center in Laikipia Airbase in Kenya. Is that so? What is the truth and what are the myths around this particular topic? We want to address ourselves to this and question some things and also look at what really is the truth, what should be our position, and what is our view even here on this platform. And I want to begin by saying Ebola has not been new. We have heard of Ebola outbreaks in the DRC for many years. Ebola is such a terrible viral disease that causes those who contract it to bleed, to hemorrhage from every pore, every opening in their bodies, from the skin, from the eyes, from the nose, from the ears, from every opening in your body. It's a terrible disease. We know that. And it has killed many in the DR Congo and also in Uganda. We have heard about that. There has been rumors of some cases crossing to Kenya, but it has never been established. But why now? Why do we have this discussion now? Why is it hitting our airwaves? Why is it trending in the media now? We want to ask why. Probably because there has been that report that the Americans, and I think it is said that this started happening during the reign of the former president Uhuru Kenyatta, that the Americans had a discussion with Kenya to establish an evacuation and a quarantine center in Kenya so that Americans who may contract or may be thought to have contracted, suspected to have contracted, or even imagined to have contracted, or even have passed through the DR Congo or the neighborhoods, can then be quarantined in that center and then observed and probably treated before they go to America. Is that racist? We need to discuss it. Why Americans? Why Americans? What about Kenyans? Those are the questions. They don't want the disease to get to their country. That is the argument some are making. And so they want the disease to remain in Kenya. That is the argument some are bringing up. But is that so? Is that so? We need to look at that and interrogate the facts. So I want to begin by asking, why Kenya? Why Kenya? Why Kenya? I want to say, why some are asking, why couldn't do that center in DR Congo? Why couldn't they do it in Uganda? Why couldn't they do it in America? In America. I want to say this in the region, and this is my thinking. You may agree or disagree, that probably one of the reasons why they couldn't do it in DR Congo is the instability in that land, is the accessibility, is the infrastructure, is the level of development. These foreigners are interested in the wealth of the Congo. They are there for peacekeeping. They are there for minerals. They are there for a variety of things. And so they fear if they contract Ebola, Congo doesn't have the facilities. They don't have the facilities. The DR Congo, they don't have the big hospitals, the research institutions, the medical centers. They may not. The personnel and capacity, we know they don't have. Most of those people, when they have challenges of health, they run to Kenya. We must start accepting as Kenyans that Kenya is the capital of Africa. I think so. Am I proud? No. I'm just saying that Kenya is a class above. We have our challenges, but we are a class above. That is why the UN, the only major UN headquarters in the rest of the world other than the West and the North, is in Africa. Because the other UN headquarters in New York, in Geneva, in Vienna, the other one is in Kenya, Nairobi, Kenya. Nairobi, Kenya. Nairobi is significant. Nairobi is significant. We matter. We bring the world here. And probably that's the other reason. Because there are so many foreigners here working at the UN agencies. They also fear if they were to contract Ebola, because they are working across the continent. Where would they be assisted? Probably that is the reason why that center is being built. The recommendation is to have it in Kenya. I know the High Court has suspended that program, whether it's if it was to take place. They have suspended that after some Kenyans petitioned that. But I am just giving my view. That probably is because Kenya is an international hub. All the major media companies operating in Africa, they have their presence in Kenya. They report the Sudan from Kenya. They report the Congo from Kenya. They report Somalia from Kenya. They report Ethiopia from Kenya. They report majorly most of Africa from Nairobi, Kenya. That is where the BBC is. That is where the Al Jazeera is. That is where the CNN is. That is where the France 24. They are here. They are here. They are all here. They are all here. They are all here. The world is here in Kenya. That is why we are attracting major meetings here. Global meetings. Climate meetings. Call it what? France, Africa Forward. France is here. Kenya matters. Nairobi matters. Except that our leaders many times let us down. Nairobi matters. Kenya matters. Leaders, you must hear this. You let us down, but Kenya matters. Nairobi matters. We are the center of Africa. Number two, there is that question of then why in Kenya? Again, let me expand that before I go to the next question. It could be Kenya because Kenya has advanced laboratories and research institutions. KEMRI, our own institution here, works with research universities and research institutions, pharmaceutical institutions internationally. KEMRI is recognized as a research institutions for medical and other issues. We have the CDC, the Center for Disease Control in Kisumu. It is the biggest in sub-Saharan Africa. Again, these are centers where probably they already have research on Ebola taking place. And someone will say, then why have these centers here? And I will say, we border Uganda. Uganda borders the Congo. Our truck drivers, they drive off the way from Mombasa to the Congo to take products there. What if they contracted Ebola and brought it back? How can we manage it? Somebody said, for warned is for armed. For warned is for armed. If we know that we are likely to have Ebola crossing over to Kenya, which is so far God has been good to us, we have not had. But also measures have been in place to interrogate those who are coming from those places. So, what if we get it? Is that the time we should run up and down looking for a place where we can quarantine the Ebola patients? So the question is, will Kenya benefit from this center? Even in the unlikely case that a Kenyan contracts Ebola, it is my opinion and the opinion of this media that having a center dedicated for Ebola in Kenya is a positive thing. When, for example, we had AIDS in this country, there are centers that were established those who can remember were old enough to remember, that were established for VCT. Others, like the Liverpool Counseling Center, and were established, and they would screen patients of HIV. And there were people who had misgivings about it. They thought now patients of HIV would come here, and so these would catch up with. I remember one time I visited the Liverpool Center in Halligan. At the Chaka place, I visited the HIV center there. And we were doing some programs on HIV. And there are those who are saying, you can't go there. Kuna ukimwi huko. That attitude, I don't think will help us. We need to have an attitude where we are prepared for all eventualities. And that is what will help us. We are prepared in advance. We take the initiative. In this country, we have researchers. We have medical doctors who have gone to the highest levels. They have PhD in medical research and other areas. Why can't we then have them in this center and get equipment that can help us deal with such eventualities, so that in case our own citizen, a citizen of Kenya, contracts this disease, then they are able to be handled in a center like that? Am I excusing the Americans that they should come and run, and be overbearing upon our leadership to establish something for them alone? No. In fact, I'll be so bitter with our leadership if they allowed a center to be established for quarantining Americans only. I think such a center should be Kenyan first, and then foreigners can come. So that if we suspect so-and-so may have Ebola, instead of taking them to Kenyatta Hospital, where there is a probability of contracting the same disease and passing it to others, then they can be taken to a kind of isolation that is already prepared and that has the requisite capacity, medically speaking, to be able to handle that without the possibility of transmitting it to others. Protocols must be established. How then do you handle a suspected case that presents? Who handles it? What is the level of interface with the various people and even the hosting community? I was in Laikipia yesterday, and I had some residents of Laikipia County complaining that if they bring this center, they are bringing Ebola to Laikipia. And so these are the questions that government must address. These are issues that government must communicate. And I have beforehand talked about government communication. It must be proactive and not reactive. We must be told, are there any protocols established? Are there policy frameworks that are in place for dealing with such eventualities, so that Kenyans then do not get disadvantaged because of our weak policy or laws? Are we keen when we sign to those agreements? Have we read every dot and known exactly what is written? There is also fear that there are individuals, probably in government, who benefit from the establishment of such a center. And there has been vibe, whether rumors or truth, I don't know. But mine is to talk that this center will be built in a private ranch somewhere. Is that true? Can government come clean and communicate? I've read on media that it will be at Laikipia Air Base. Will our soldiers be secure? Those are the questions we want answered. And I think instead of government being defensive, it can also give information that is necessary, because Kenyans are learned. They can understand. We can read it through. We can understand. If explanation is given and the things are done in the open, and I think that is not asking too much, The government must give information because our new constitution grants Kenyans the right to access information. So what is the part of Kenyans? Is this program discriminatory? We have asked that. And I have said, if then it is just being done for Americans on our land, I'll be the first person to say no. If such a center is established, it should then benefit any Kenyan who happens, for whatever reason, to fall victim to this particular very serious disease, or is suspected it too. They should be able to be assisted. And then we need to ask also, do we need such a center? Again, I've said, I think not only for Ebola, we need centers of excellence, centers where research is done. CDCs, KEMRI, we need more. Governments in the West, they put most money in research centers like this. They will research on possible happenings. They don't want to wait for things to happen. They will develop vaccines because research has been taking place. And I think as Africans, we must not look down upon ourselves. Our scientists are able to develop vaccines and cure. We have seen those abroad who are working in foreign universities and research institutions developing medicines. In fact, there is a Kenyan doctor recently who won 446 million together with a research group to advance research, biomedical research. Can we bring such here and provide resources for them to continue such research? I know in Kilifi we have a center for research that researches on yellow fever and other diseases. Are we going to have this kind of, centers empowered through funding by government? Shall we also turn our universities into research institutions who can come up with the solutions to issues that we have, like cancer? Today, for example, we know there is a substance in bee venom, melittin, that has ability to puncture the cancerous cells, especially for breast cancer, and can heal. Now we have that information. Are our scientists following up to find if we can get a cure for that in Kenya? And that is my thinking also. Ebola must not be seen like a death sentence. We must sit back. We must pull our socks. We must fund and be a leading nation in seeking for treatment for Ebola or even vaccines for Ebola. Every problem is an opportunity. The West has established that, and they make sure that what we call a problem is an opportunity. When we had COVID, whether it was manufactured or not, it is the Westerners who provided us a solution at a cost. When will Africans develop, vaccines and medication for such conditions, for syndromes that we have not understood, so that then we can also export solutions? Why are we always consumers of solutions? Did God make us lesser? I don't think so. Our universities and research institutions, and I am happy that we have turned so many of our senior hospitals into referral research hospitals. They are used for education. The Moi Referral and Teaching Hospital, the Kenyatta University Referral Hospital, the Jaramogi Oginga Referral Hospital and Teaching Hospital. We have them, and there are many. Are we going to see real research taking place in these centers and convert them into centers of excellence? And I think these are the centers where we would have such quarantine centers if then we were up to it in Kenya. Now, we must also, as Kenyans, I think, not bury our heads in the sand and imagine that Ebola cannot come to Kenya. And so we need to be prepared. And that is what I think. And finally, on this particular matter, I think we have raised a lot of arguments, a lot of, pessimism and so on. But me, this is what I would look at. Is this quarantine center, going to benefit an individual or a nation? And so if it is established, for example, it is an enterprise for somebody to benefit financially, then it's a no. It's a no. But if it is a national center set in a public institution, and we have enough of them, then such a center and the funding that comes with it is a necessity that should have happened like yesterday. If Ebola is in Congo, Congo is a day or so to here, people are moving from Congo to here. We have many Congolese in Kenya. We have many Kenyans going to Congo for business, for what? Transport and so on. So we need to have a center at ready in case it happens to us. Then we are not running up and down like a headless chicken. We must be prepared. We must be prepared. Even the good book, the Bible, tells us if someone knew when the thief would come, then they would have been prepared. But you never know when the thief comes. You may never know when such a sickness comes. And I'm saying that we need to be armed. We need to up our game. We always talk about the Americans, and the reason why they are ahead of the rest is that they prepare in advance. They don't wait for the neighbor to come and extinguish their fires. They have their fire extinguishers before the fire happens. Africans, we must wake up. We must have our fire extinguishers before the fire happens. We must not wait until there is hunger for us to ask where the food is. We need to have the food before the hunger comes. We must not run around until the fire comes and then we are going to borrow the fire extinguishers. We must have the fire extinguishers. When the fire comes, we have something to put out the fire with. We must not wait until Ebola comes and then we are running up and down asking for help. We must train our people and equip our people and build capacity so that if it happens, even if it is only one Kenyan, that one Kenyan can be taken care of without fear and without the danger of contracting others with the same. And that is my take. Shalom. Thank you. Until another time. This is James Kemadi. You can subscribe. You can talk to us. You can interact. There is a number down there. You can use it and talk to us. Let's hear from you. Thank you.